The following program is made possible by you, the TBN partners, and is only here because of your generous support. The following program does not necessarily represent the views of the Trinity Broadcasting Network.
Welcome to Joy in Our Town. I'm your host, Athena Sorenson, and today we have two guests. This is Violet Horvath. She has a PhD, and she's the director of Pacific Disabilities Center with University of Hawaii and John A. Burns School of Medicine. And this is Sean Cho. He is a Master of Social Work Practicum Student. Thank you for being here today.
Thank you.
Thank you.
Okay, now what is Pacific Disabilities Center?
We are a center that does various research projects and community outreach and development, working with individuals throughout Hawaii and the Pacific, anyone who has any type of disabilities, to try to better their lives. Okay. That's kind of it in a nutshell.
Okay. Well, that's wonderful. So who has strokes? This is something that goes on, and it's something unexpected that happens, but who exactly gets strokes?
Actually, the most common one that happens about 87% of the time, is called an ischemic stroke, and that's when fatty deposits build up in your arteries and clog. Okay. So there's a loss of oxygen to the brain, and that's the most common type there is. But there's also what's known as a hemorrhagic stroke. That's usually associated with unchecked high blood pressure. And think of like a balloon that gets filled with too much air, it bursts. Well, that's the same thing that happens with the blood vessel. There's too much pressure, so it actually bursts, and there's an aneurysm. So that happens less often, but most, they're both very devastating, of course. There's also something called a transient ischemic attack, or a TIA, and this is what's known as like a mini stroke. It might be so slight that people don't even realize they're having it. People can have a stroke in their sleep. They might notice something's a little bit different. And a TIA is also known as a warning stroke, because it's about a third of people who have had a TIA go on to have a full-blown stroke about a year later. Okay. So it's a partial blockage due to those fatty things that clog up the veins in there, the arteries.
And what are the symptoms of those different strokes? Like, how would you know? Because you said you could have them in your sleep. Would you get a headache? Would you have blurred vision or something?
I'm going to let Sean, our practicum student, answer that one.
Again, for having a stroke, the symptoms could vary between people. However, the most common ones would be having a sudden and severe headache with no known cause, sudden dizziness, loss of balance or coordination, trouble seeing out of one or both of your eyes, sudden confusion or trouble speaking, numbness or weakness of the arms or legs, especially on one side.
And one other thing on all of those that's key is it's sudden. And like the headache can be very severe, but it comes on very suddenly, or the sudden numbness or weakness.
Okay, so it's not that you've just been kind of not feeling well, it's just you're walking down the street and then boom, you all of a sudden have like this sharp headache type of thing. So that would be a sign.
Yep. Yeah. There's an acronym to remember the most common and the most important signs. It's called FAST, F-A-S-T. So the F stands for face, so any side that starts drooping. A for arm numbness or weakness. S for speech, which is slurred speech. And T for time. In other words, call 911 as fast as you can.
Okay. So if you see someone and they're having like this droop, they can't move their arm, they don't, maybe some confusion, you would know they're probably having a stroke, or even for yourself.
Yes. And as Sean mentioned, the last one, the T, time, is absolutely essential. Even if you have any thought that you or someone else is having a stroke, call 911 immediately. Don't try to drive yourself to the hospital. Don't have someone else drive you. It's best if the ambulance takes you, because depending on the type of stroke that you're having, they can potentially start treatment while you're in the ambulance.
Okay.
And the sooner they can start treatment, the better your outcomes will be.
Okay.
So if you're having an ischemic stroke where the clot is occurring, in some cases, they can administer this clot-busting drug called TPA that has had some remarkable success, as long as they can get to you in a timely fashion.
Okay.
And here in Hawaii, too, we actually have a telemedicine project where physicians at Queens Hospital are contracted with hospitals actually around the island and in North Shore and other places, where they do telemedicine to assess what kind of stroke the person is having, and then under the physician's direction they can do the clot busting drugs.
Oh, wow, and save their life.
Save your life,
Yeah.
absolutely.
Okay, now who gets strokes? Like, who is the most susceptible to getting a stroke? Are there certain ages?
Absolutely. We tend to see strokes mostly in those who are 65 and older.
Okay.
And just about 75% of strokes occur in that age group. And also in that age group, when they have a stroke, it tends to be very debilitating. But what we're starting to see more and more are younger people having strokes. I mean, the reality is you can have one at any age.
Right.
But what's happening is we're seeing, as people are less active, they have sedentary jobs, their diet is bad. We're starting to see especially more and more high blood pressure that's unchecked, high cholesterol, and those are some of the risk factors for having a stroke. And we're seeing that more and more in younger people.
Now, is it due to stress as well? Is that
That is part of it.
part of it? Okay.
That is absolutely part of it. There are actually so many things, and maybe Sean, you want to talk about what are some of the things we can do to prevent?
If we're trying to prevent a stroke, one of the most common things would be to monitor your blood pressure. A variety of places can check your blood pressure for free. Even at the supermarket, they have like those little
Those
blood pressure
machines that you sit
Yeah.
down, put your arm in? Yeah.
So it's a good idea just to keep that monitored. Another one is to get with your doctor and manage your cholesterol. It may require different kind of treatments, but that's something you definitely want to have checked. Other ones that we can do on a daily basis are like stop smoking, which alleviates tons of different health maladies. Losing weight, diagnose and treating diabetes if you have it, and find ways to manage your stress.
Okay. Yeah.
And we, like the work that we do, although we're out in the community quite a bit, there are stretches when we're sitting at our desk for long periods.
Right.
So what I've started to try to do is to get up about every hour, walk, stand for about 2 or 3 minutes, get the blood circulating, right? That's very important, the circulation. And that should help also.
Okay. Now, you talked about FAST, F-A-S-T, but are there other symptoms beyond the FAST? Of
Yes.
facial drooping and all
Actually, for women, some studies have shown that they have different symptoms. Ones that may be not common or kind of easy to dismiss as not a stroke. Some of them are a loss of consciousness or just regular fainting.
Oh,
General weakness, fatigue, and hiccups.
really? Wow.
Confusion, unresponsiveness, or disorientation, is feeling a little bit dizzy. Sudden behavioral changes, like a mood swing, agitation, hallucination, and even nausea, vomiting, pain, or seizures.
And these are all symptoms that women would have
Potentially.
that a man doesn't necessarily get.
Yeah, for
Okay.
a long time, we thought everybody had the same symptoms. So what was happening was that women were just ignoring it, saying, oh, it's not that,
It's hormones or something.
Or they would go in and they wouldn't be treated because the doctors did not recognize them as having a stroke.
Okay.
Yeah.
So there they were having a stroke. They go in and then they didn't treat them, and then
Correct.
they would have a more severe one later, and possibly.
Possibly, yes.
Okay.
Once you've had one stroke, you're far more susceptible to have both more strokes and also heart attacks.
Okay.
And then if you think about it too, because a stroke can, one of the things, confusion, loss of concussion, loss of your balance, people who have had strokes may also end up with concussions or traumatic brain injuries.
Wow.
It makes you more susceptible. And someone who's had a concussion or a traumatic brain injury is more likely to have a stroke.
Wow.
Yeah.
Weird.
Yes, it is.
So how does someone recover? Because when you said the facial drooping, it's true. Whatever side of the brain has the stroke, the opposite side has weakness. Is that correct?
It's usually on the, what you go ahead.
The same side.
It's usually the same side.
For rehabilitation post-stroke, the best thing to do is get with your doctor so that they can come up with a treatment plan. For some caregivers, if you're going to be taking care of maybe your mother or father or a loved one that has had a stroke, remember that many times for caregivers, places offer respite services because it gets very, very stressful and manages a lot of your time. So one thing to always remember is that it's going to be a long process. Things may not happen overnight. There will be some strides that happen within the first 3 months, but everything else after that will take time. Just have to remember that.
So depending on the severity of the stroke, if it's a really bad one, that person, if they do have the weakness, they could have blindness, correct?
I think potentially, yes.
Potentially they could have
Yeah.
blindness. So when they do go home, would everything in their house have to be changed for them?
Some things will be different. Usually when you get with a doctor, the care plan will involve someone coming out to the house to making sure that it's safe for that person to go home. With that home visit, the survivor of the stroke may need some extra supports, like grab bars around the house, making sure that the floors are clear of anything that could potentially cause them to fall down, loose rugs, or just daily things around.
Okay.
They might need a walker. They might need to use a wheelchair or a power chair or a scooter. You know, if you're right-handed and you've lost feeling and weakness there, you're going to have to learn how to hold on to things with your left hand, you know, things like that. So there will be a variety of exercises that they would do, try to help restore their balance also. So it's going to be different for each person. And we were talking about the risk factors earlier. There's a lot that we can control, but things like age, gender, ethnicity, those also are risk factors, and obviously those we can't do anything about.
Right. So you can just, like you said, if it's sudden, it'll just come out of nowhere. And you can, even if you are exercising and eating right, if it's genetic,
Yes.
we found this genetic, you can just have a stroke, correct?
That's true.
Okay. Can someone recover, fully recover after a stroke? Have you seen that happen?
We have. It, again, a lot of it is time. How fast do they get in and get treatment? Age does play a part. How healthy the person is to begin with will also be a factor. So the healthier you are going in, typically the easier the recovery is for you. But absolutely, I mean, sometimes, as I said, people will not even realize they had a stroke. But pretty much for everyone, you can make some small gains at least and work at it. But yes, there is the potential, depending on how severe it is, age, health, and other things, that you can have a full or a fairly full recovery.
Okay, so there is hope.
There is hope.
Okay.
Prevention is always the best, of course.
Right. Okay, now you brought up a little bit ago that strokes are tied into brain injuries and concussions. That is something that we see a lot in sports. What exactly is a concussion? Because I think that there might be some misinformation out there of exactly what that is.
Well, just like there are different types of stroke, as we talked about, there are also different types of traumatic brain injury. That's the broader term for all of this, or you'll hear TBI. And most people, not all, but most people, when they talk about a concussion, what they mean is that somebody had a mild traumatic brain injury. But there also can be moderate ones and also severe ones. And one of the things, we'll talk about signs and symptoms later, but one of the fallacies is that people think, well, I didn't lose consciousness, so I must not have had a traumatic brain injury or concussion, and that's not true. Even sometimes if it's severe, you might not lose concussion. So that's not the only thing to consider. And just like with strokes, a lot of times people have absolutely no idea that they had one.
Really?
Yeah, they can't. It's like, I don't remember anything happening. I didn't feel funny. I didn't see stars. I didn't lose consciousness. None of those. I didn't have memory problems, but yet they still did sustain some kind of brain injury.
Wow. Now, would you get all the symptoms at once, or is it possible to get a concussion and not have symptoms till later?
Absolutely. Either way. Could have them immediately, could have them later. They might just show up later. You never know.
Never know. Okay.
They might show up years later.
Really?
Yeah.
Wow. So it's not an immediate thing. It wouldn't be like a couple of days. It could be a few months to wow.
It could be. It could be any time period in there that some signs and effects may show up later.
Okay. So what exactly are symptoms of a concussion?
Well, again, like the loss of consciousness could be one of them. You know, they do talk about the seeing stars. You might experience some confusion and disorientation, things like that.
Okay.
Yeah. And it has to do, like strokes are different in different individuals. The same are true for traumatic brain injuries. What happens is it's not the movement of the brain in the skull, it's when the brain hits the skull.
Oh.
So, you know, let's say you have whiplash and you go forward, it's when you go back and like your brain hits the back of your skull, or sideways, or some of the most damaging ones are rotational ones. So a lot of what happens to you afterwards is going to depend upon how hard it hit, where it hit, and so on. So it can be very different in people.
Okay. So the symptoms could be different just depending on, like you just said, where and how the brain hit the inside of the skull.
Absolutely, and how hard it hit and so on.
Okay. Now, are concussions only for athletes? Because everybody says, oh, you know, they're out playing sports. There's other ways to get them, right?
That's the most high profile. We see NFL players especially. We're hearing a lot about that, but trust me, everybody, again, like stroke, everyone is susceptible. Most common tends to be motor vehicle accidents, and then also falls. But also the things that we don't tend to think about is they could be due to physical violence, being hit, domestic violence. Men and women who have been the victims of domestic violence may experience traumatic brain injury. The sports injuries, of course. But also, we don't think about this as much, but explosive blasts or any other combat injuries. So let's say there's some kind of an explosion and something penetrates the skull, that's an injury. But also, they think that, and they're not too sure about this yet, but they think that, let's say there's an explosion, there's no penetration, but the pressure from the blast somehow disrupts the brain function too.
Oh, wow. So you don't actually have to hit your head, per se.
Exactly. That's correct. You actually don't even have to hit your head.
Huh, that's kind of a scary thought.
It is.
Wow.
It is.
Oh my goodness. Okay. So when should someone seek medical attention immediately when it comes to concussion?
It's a little tougher on this one because, like we said, you don't know sometimes. You may be totally unaware. If you're in organized sports and there are coaches and trainers, they should take you out immediately if there's any question whatsoever. You know, if you're just doing casual sports with a team, you know, anything you think, even if you don't feel just right, take yourself out. Go see the doctor. Better to be safe than sorry. Any kind of fall of any kind. One thing I read recently that I didn't even think about was a pediatrician was talking about don't pull up the high chair next to the table. Because, you know, like little kids like to push against things. So what would happen is the kids would push up against the table and fall back in the high chair and hit their heads. Like, I didn't even think of that.
Yeah.
You know, so There are all kinds of ways that it can happen, and it's just better to be safe than sorry, and to remember that you might not experience any symptoms right away. Maybe it's a few days down the line you're starting to just get really confused. Your words don't seem to be coming out right. Things are just not right. Go in and get
Go
checked.
and see the doctor. Okay.
Yeah.
What are the danger signs in children? Is it different than an adult?
No, they are actually similar. But the problem is, think about the younger a child is, they may not be able to express it. They can't tell. So again, better to be safe than sorry.
Okay, so if you're a mother and you have a child, you just notice maybe they're not responding to you, or they're not their usual self.
Yeah.
Just take them.
Absolutely.
Okay. Are all traumatic brain injuries the same?
No, as we talked about earlier, they are very different. It's really going to depend on age again and your health. And again, where did the brain hit? How hard was it? What kind of consequences were there after that? How soon you get treatment? So there's such a difference. Yeah.
Okay. And are you finding that out in the community, that there is not as much awareness as there should be about brain injuries?
Yeah, Sean goes out to a lot of our events, so he can talk about that part.
Yeah, many times people don't realize the severity of their brain injury, and when later on down their life, or even a couple of days, they'll tend to forget certain things, or just have like a specific amnesia for that moment. That itself is already a huge warning sign that it may be a little bit more severe than you originally thought.
Okay. So people just need to know that even just a small symptom is something that could be serious.
Usually an EMS or a first responder will ask you certain questions, like, do you know what day it is? Can you tell me your name? The basic identifiers to kind of see if you're disoriented, and that could possibly lead to a sign that you've had a brain injury.
Okay.
When we're out in the community, we have our sign, Hawaii Neurotrauma Registry Project. And the question we get most often is, what are neurotraumas? And there's been a lot of publicity lately about concussions and brain injuries and stroke. And it's still really surprising how many people have no idea what the risk factors are, no idea what the signs and symptoms are. And we're talking about across all age ranges. In the terms of traumatic brain injury, the recent movie Concussion, that has actually done a lot in the events that we've gone out to since then, especially the parents. They're like, oh, I saw that movie, Now it really brought it to their attention, and now they're more worried about their children and have a better understanding of what they need to look out for and so on. Of course, that movie shows the extreme cases with the NFL players and the chronic traumatic encephalopathy, which is it's a type of brain injury that, excuse me, let me go back. It's a degenerative disorder that occurs as the result of multiple brain injuries.
So many times, yeah.
Absolutely.
Okay. Now, spinal cord injuries, that's also something that people get for whatever variety of reasons. So what exactly is a spinal cord injury? Because that's different, right? Because that affects your cord going all the way down.
Yes, and it could be anywhere along the spinal column. It could be concentrated at the top, the middle, the bottom. It could be in various parts of it, depending on how it occurred. So you could imagine something like a motor vehicle crash. Somebody could have fractured their spine in a variety of areas, or maybe it just happened up here around their neck, and where it is and so on is going to dictate the severity of the injuries that come from that.
Now, do all spinal cord injuries result in the inability to walk or use your limbs? Or can you actually have a spinal cord injury where you can still use your limbs?
You still can, just like with strokes and traumatic brain injury. They're going to be different degrees. And again, people's age and their health before it occurred will also be part of that, to how they recover, whether they recover, to what degree, and so on.
Okay, because I think most people think spinal cord injury, that means you're not going to be able to walk, but you could actually have one and still be walking around.
Yep.
Wow.
Absolutely.
Okay, now what would be the long-term complications of something like that?
Well, there's going to be degeneration in those discs, so pain, and so maybe someone now, at this point in their life, they are able to walk either without any support, maybe later they need a cane, down the line they might need a walker or a wheelchair because, those discs, that injury is still there, so the discs further degenerate. So there might be a lot of pain. Pain management becomes critical on all of this, yeah.
Okay, and are we seeing a lot of spinal cord injuries here in Hawaii?
Not a lot, but mostly due to motor vehicle accidents. But it could be something too, here in Hawaii especially, because so much swimming and diving goes on. If someone dives into shallow water or the depth in a pool, they think it's deeper than it is, and hit their head and their back.
Oh, yeah.
So in Hawaii, we see a lot of that where people have injuries, spinal cord injuries, because of diving accidents.
Wow. What happens to someone if that? Like, what do they do? If they hit their head, they're out there alone, or how are they found? Hope that they have someone with them, or?
Yeah, definitely.
Absolutely.
Yeah.
Well, yeah, you got to think about really, for all kinds of reasons, not just in case of a spinal cord injury. If you're out somewhere, you want it best to be with someone, have someone know where you are and when you're expected back, so that if you don't return, or, we have so much hiking that goes on. You hear the stories in the news where someone has fallen off of a trail.
Yes.
Sometimes they're okay, but sometimes not.
Yeah.
Yeah.
All right. Well, thank you so much for all your information. That was a lot to cover, and a lot of really good stuff people need to know.
Sure.
Thanks for being here.
Yeah, and they can certainly contact us about the Hawaii Neurotrauma Registry project.
Okay.
They're interested, we also do presentations. We go out and do presentations on these topics.
Okay. Well, thank you so much.
Thank you.
And if you have any questions or comments, you can write to TBN, P.O. Box A, Santa Ana, California, 92711, or visit us on the web at www.tbn.org. And thanks for watching.
This program has been sponsored by the Trinity Broadcasting Network and made possible by your telethon dollars. Your continual support can keep Joy in Our Town brought to your home every day. So write Joy in Our Town, P.O. Box A, Santa Ana, California, 92711.
400 years ago, King James commissioned 50 scholars to translate the Bible from its original manuscripts into English. In 1996, the New Living Translation was completed to create a new text that would be easy to read and easy to understand. For your special gift of $100, TBN would like to send you the TBN Parallel Bible, containing the King James and New Living Translations side by side. This gold leaf edition conveys the meaning and content of the best-selling book in history. This special edition Parallel Bible includes a Bible verse finder, an index of Bible promises, plus a Bible reading calendar to help you read your Parallel Bible from cover to cover. To receive your TBN Parallel Bible, send your special gift to TBN, P.O. Box A, Santa Ana, California, 92711.
They said I would die.
My doctor told me I had ALS.
They said I wouldn't live to see my kids grow up.
But their doctors were wrong. Multifocal motor neuropathy, referred to as MMN, is a rare disorder that progressively weakens muscles in the extremities and is often mistaken for other serious neuropathies, as well as the ultimately fatal condition known as ALS or Lou Gehrig's disease. But unlike those disorders, MMN affects only lower motor nerves and has no sensory involvement. Symptoms tend to be asymmetric and characterized by weakness, cramping, twitching, or muscle atrophy, usually beginning in the hands. Disease progression depends on the length of time the patient remains without the correct MMN diagnosis. With early diagnosis and treatment, most MMN patients continue doing the things they enjoy.
Cooking.
Gardening.
Spending time with my family.
For more information, please visit these websites.
You're watching TBN, celebrating 42 years of God's miracles.